So now I want to talk specifically around diagnosing ADHD. And we're going to go through the DSM criteria. We can now go through them quite quickly because you've, I think, got a bit of a picture now of what it's like to live with ADHD. So it falls now under the DSM-5. It's actually been put under the neurodevelopmental disorder category together with autism, for example. And typically with ADHD, there are these different criteria. With DSM, there's criteria that you have to fulfill. We do see that a lot of ADHD, especially in adults, are missed. And there's a few reasons for that. The first is the DSM was very much designed for diagnosing ADHD in children, especially small children, you know, under the ages of 6, 7. So it's all based on the observations of other people rather than just what's going on inside this person's inner world, which is actually where everything is happening. The inattentive type that I've mentioned, where you're stuck in daydream mode, which doesn't have any hyperactivity, is often missed because people have this sort of set idea of what they think it should look like, especially in the girls. And some people with ADHD do manage to mask. So it means that they seem quite organized. You can people with ADHD that, you know, they seem to get the job done. They manage through life. But one doesn't see the amount of effort it takes for them to try and stay on target and the amount of hours they spend organizing and trying to keep things on track. Some people with ADHD might also have had strong protective factors depending on where they grow up. So say, for example, they've had super organized parents, they're quite a small, very structured school with people sort of helping them out along the way. They might end up marrying a partner that's super organized and keeps all the organizational stuff on track, and they can just be the creative artist, for example. And if they're highly intelligent and have a high IQ, they can use some of their other strengths to sort of compensate for the areas where they are struggling. But quite often ADHD gets misdiagnosed for something else because of all these potential comorbid conditions, which we'll look at next. So these are the kinds of things where ADHD quite often sort of gets masked by other stuff going on. And in the one study, up to 87% of people with ADHD had a comorbid psychiatric condition, and 57% of them had at least two, with the most common being anxiety disorders and depression, but also a very high rate of substance abuse, much higher than the average population. There's also personality disorders, and there's a question here, is quite often what they call a personality disorder is actually a misdiagnosis. So somebody who seems quite narcissistic, but they're actually hyper-focused and on a roll and just not aware of the amount of havoc that they're causing around them. Eating disorders is a major issue, partly to do with this inability to also control impulses, and also to not always even be aware of how hungry they are or where they are at. So very chaotic eating. Various behavioral disorders due to impulsive behaviors. And also there's a higher chance if you have, for example, there is some overlap with autism and ADHD or dyslexia or dyspraxia. So the neurodivergent conditions, there's quite a bit of overlap as well. And there are a higher risk of comorbid medical disorders, as we've mentioned earlier, due to behaviors. So to screen for ADHD, there's the standard self-screening symptom checklist that people use. It's called the WHO Adult ADHD Self-Report Scale. It's got an 18-item checklist. And it's actually got quite a good sensitivity. So you can see the specificity is 99.5%. If you fill that in truthfully, you can be fairly sure you have ADHD. But it's going to miss a fair amount because it's still very much based on the DSM. So it might still miss 20-30% of people who do have ADHD. There are a 6-item adult self-report scale that you can actually find on your calculator. So if you look up ADHD on your medical calculator, you will find the 6-item scale. And that's just for you to say, okay, maybe we should go on to them doing the 18-item scale. If on the 18-item scale, a person is identified as having ADHD or possible ADHD, it is important that they get seen by a professional that can make a proper diagnosis, and they use an diagnostic interview. So similar to autism, you're trying to understand what's going on inside their heads, not just in how they're seeming on the outside. You want to know exactly, well, they seem organized, but how long does it take them to organize? So, and in that is also a functional impairment scale to see how much that impacts. It can also the reason why you want an expert to make the diagnosis is that all these comorbid mental disorders like anxiety or depression is going to really muck with what you're seeing. So if somebody's very depressed and very apathetic, that can also look like inattentive ADHD. And of course, the two can cause each other. So you do need an expert to understand all of that. But this is the tricky bit with ADHD. So as ADHD, and we'll talk about the drugs in a minute, we use stimulants as our main treatment for ADHD. There are people who do not have ADHD who want to get hold of these drugs. And at the moment in the UK, there's a massive shortage of Ritalin because for the children who need the Ritalin because of misuse by non-ADHD adults of Ritalin. So the problem is it's very easy to charge, to cheat on the chart. You know, if you have to fill it in yourself, it's got quite obvious what they're looking for. And so your only way to be able to actually understand whether this is correct is to get collaborating history from family, work colleagues, and partners. And that's also, and look, mainly to protect against malingering students. I have a bit of stats on that in South Africa in a minute. This is just to show you, this is the 6-point scale. And you can see it as about how do you struggle with a project, getting things in order, remembering stuff, fidget or squirming. So it's sort of a very 6 basic questions. And then that's the 18 scale, 18 question, self-questionnaire that one can fill in. And that's kind of useful if somebody just wants to start getting an idea, and I'll send these round. So when you're going to diagnose your patient using DSM-5, there are 3 types. So there are criteria for inattentive type, there are criteria for the hyperactive impulsive type, and then there's the combined type where you, if they have criteria that meets both. So let's just start with inattentive type. So inattentive type is if there's a persistent pattern of inattention. And so that's number 1 here that we're looking at. And I'm going to show you 9 criteria. And you have to get at least 5 of those criteria in adults. And you'll see it's actually 6 in children. It has to have been there for at least 6 months. And it mustn't be due to something like oppositional behavior, defiance, hostility, or failure to understand tasks or instructions. And here are some of those. Here are the nine criteria. So often fails to give close attention to details or make careless mistakes. Often has difficulty sustaining attention in tasks or play activities. So struggling to remain focused in a lecture, for example, or even in a movie. Often does not seem to listen when spoken to directly. So you speak to them and they seem to be wandering off somewhere else. Often does not follow through on instructions and therefore fail to finish stuff that's supposed to be done, especially routine things like chores. Often has difficulty organizing tasks and activities, so keeping stuff, everything goes a little bit of chaos around them. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, so hates doing their bookkeeping at the end of the month. Often loses things necessary for tasks or activities, and there's a whole list of all the possible things they might lose, usually at the essential moment when you need it, and is often easily distracted by extraneous stimuli. And the last one is often forgetful in daily activities, so forgetting to run a chore, forgetting to do basic things, forgetting to pay a bill, etc. So if you have 5 out of those 9 criteria, then you would qualify as inattentive type ADHD. The hyperactive type has also got 5, although interestingly in the guideline from South Africa, they're even suggesting we might only need 4 of those criteria met. And it's for both hyperactive and impulsive. So there's 9 out of which you need to get at least 4. So often fidgets or taps hands or feet or squirm in the seat. Often leaves the seat in situations when remaining seated is expected. So getting up when they're not supposed to be getting up. Often runs about or climbs in situations where it's inappropriate. So that's in children, but in adults, that might be this feeling of restlessness. Often unable to play or take part in leisure activities quietly. So being able to sit down and just read a book or sit down and watch a movie. Is often on the go or acting as if driven by a motor. So others might feel like it's difficult to keep up with them. Talking excessively. So not everybody necessarily running excessively. Often blurts, so this is the impulsivity criteria, so often blurts out an answer before a question has been completed, often has trouble waiting his or her turn, or often interrupts or intrudes on others in activities or sort of interferes with what other people are doing. So again, we're looking for 4 or 5 out of those criteria for the hyperactivity, impulsivity ADHD. And in the combined subtype might be somebody who actually has 5 of the inattentive types as well as 5 of the hyperactive types, and then they actually will have the full ADHD. So of course, in DSM, there's always the basic conditions. The symptoms must have been present for at least 6 months, must have been there before the age of 12. So actually getting a history from parents or people who've known the person when they were young is very helpful, especially if you're concerned about malingering. And these things would have been more pronounced usually in a school setting where the child hasn't quite yet learned how to manage. It obviously must be affecting them in different contexts, so not just at work, but also at home, for example. It must interfere with their life. And this gets tricky because you can get people with ADHD who's managed to create a lifestyle, like an artist maybe, who keeps his own hours and their own time and does their own thing. But you need to really delve deeper in looking at the levels of anxiety and difficulty in some of the daily activities of life, for example. And of course, the symptoms must not be explained by another mental disorder. Severity, the DSM is, this is quite a vague scale. It's basically got to do with how much it impairs your daily functioning, whether it's social or occupational functioning. And there's a mild, moderate, or severe, depending on the level of impairment.